Well, dear ones, we've reached peak institutional codependency. The government literally had to tell grown adults it's okay to get a vaccine. But what does this beautiful psychological dysfunction reveal about our collective inability to adult? It's absolutely fascinating how we needed a 2-day committee meeting to decide whether people can protect their own health. The CDC Advisory Committee spent 48 hours discussing whether 6-month-old babies through senior citizens should be allowed basic healthcare access. Of course, they emphasize shared decision-making because heaven forbid we trust individuals to think independently. Insurance covers everything with zero copay because we've conditioned ourselves to need financial validation for self-care. But here's where our dysfunction gets really exquisite, darlings. Different states formed their own little therapeutic coalitions with competing expert recommendations. The West Coast Alliance and Northeast Collaboratives are creating separate validation systems because apparently one authority figure isn't enough for our fragile psyches. Each group needs to be the most helpful parent to their emotionally dependent populations. And here's the devastating truth about what this really reveals. We've created the most codependent relationship in human history between citizens and institutions. Adults literally cannot make basic health decisions without committees, insurance approval, and multiple expert permissions. They removed prescription requirements because our healthcare system was too overburdened handling people asking for medical care. This isn't about vaccines. Precious ones, it's about our terrifying inability to take personal responsibility without someone else's psychological approval. We've infantilized an entire society and called it public health.